Well, the Federal Communications Commission adds nearly $200 million in support for health care and telemedicine programs in rural communities. RFD-TV's Sarah Mock has more in today's Rural Healthcare segment.
The FCC is betting technology can help bridge the health gap in rural America.
There's a doctor divide in this country where in rural communities in particular, access to basic care, let alone specialized care, is extremely limited or multiple hour drives away.
The FCC currently supports connectivity in hospitals and other medical facilities with a program that receives $400 million a year. Now they're doubling down, adding almost $200 million additional funds to support communities and organizations. The issue, Carr says, is that when patients leave the hospital, they're too often on their own.
One thing we're seeing in telehealth is this movement towards connected care everywhere. Remote patient monitoring is a piece of it. We've seen some pilot programs in Mississippi where they're tracking diabetes patients and seeing improved outcomes. We've seen it for opioid dependency. We see it from telepsychology services as well, essentially FaceTime visits with therapists.
With the vast majority of healthcare spending going to the management of chronic diseases like diabetes, COPD, and asthma, shifting to virtual medicine, where doctors monitor and interact with patients through smartphone apps or connected health monitors, patients can stay healthy without leaving home and avoid the cost of doctor or emergency room visits. Carr says a virtual interaction with the doctor can cost 75% less than an in-person visit.
You can get access in your own community to a specialist that's hundreds of miles away. So you're getting access to quality care. A lot of times it's over video connections as well, so you do have a better connection with the doctor. In some cases, we've seen $1 spent on remote healthcare monitoring technologies result in $3 worth of savings for the healthcare system overall.
In recent weeks, the FCC has moved to increase funding for its rural health program budget by $171 million a year, with a specific focus on telemedicine. Carr says he's looking forward to seeing how funds will help communities access world-class medical care at a price they can afford. For RFD-TV, I'm Sarah Mock in Washington.
Commissioner Carr continues his Rural America tour in the South, discussing telehealth throughout the Mississippi Delta. He'll then travel to Alaska to learn more about the unique rural broadband challenges in the far north. Follow the commissioner on Twitter at Brendan Carr FCC. Well, meteorologist Tim Ross